Have you ever been called a hoarder? In Gail Blank's book entitled Throw Out 50 Things, Clear the Clutter, Find Your Life, she wrote, everything is separated between keep, give away, and trash. A hoarder has a hard time throwing out anything because they feel they need to keep it. And they might need it someday. But most of us have collected things over the years that are valuable to us. A hoarder collects much more than jewels. They collect trash, junk mail, just things that's no good. And they collect so much trash and junk it takes over their entire living space. But a collector, on the other hand, collects much more than precious jewels. They collect valuable things, and they are very proud of their things, and they like to show it off with great pride. I feel that I'm qualified to talk to you on hoarding because I've not only done a great amount of research on hoarding, but also I have known people who are hoarders. Today I would like to inform my audience of the symptoms and risk of hoarding. Many people are not aware of the symptoms of a hoarder. I will be informing my audience of the symptoms of a hoarder, the risk of hoarding, and treatment for hoarders. Someone who hoards suffers from a lot of anxiety, distress, and obsessive behavioral thoughts, such as thinking someone is taking their trash, and they're always checking the trash to make sure nothing's been thrown out. In the book Psych 101, written by Paul Kleiman, he wrote, while obsessive compulsive disorder can occur at any age, symptoms usually occur within two distinct periods: before puberty, which is known as early onset OCD, and later in life, which is known as late onset OCD. Some of the symptoms of hoarding are as follows: not wanting to part with any of their possessions, not wanting others to touch their pile of clutter, and piles of clutter all over the house. They have newspapers, magazines, and junk mail laying all over the house, and they keep old food in the refrigerator. They think they need it, and they're always moving things from pile to pile, and they isolate themselves from families and friends. I have informed you of some of the symptoms of a hoarder, but I'm sure you're still wondering, is there a cure for a hoarder? There are several risks of which a hoarder has, and one is risk of fire due from all the clutter, roach and rat infestation, which can cause diseases, and then respiratory infection due from all the mold and mildew, and family dysfunctions due from all the clutter, and sometimes they have loss of job. In USAtoday.com, it was stated by Heidi Brown, the hoarders don't just fill their homes with books, papers, and knick-knack collections. In some cases, well-meaning people often wind up collecting animals as well. It becomes a problem when these animals are not taken care of, causing them to suffer from neglect, starvation, or other untreated medical problems. There are two kinds of treatment offered to a hoarder. The first one is oral medication such as Paxil, Prozac, Zoloft, or Celexa. The second is cognitive behavioral therapy. In the book, When Panic Attacks, written by David D. Burns, he described it as cognitive behavioral therapy is based on the idea of your thoughts create all your emotions, positive and negative. Not all patients respond to the treatment, but most do with the help from others. In conclusion, my purpose was to share with you the symptoms of a hoarder. I have shared with you the symptoms of a hoarder, some risk of a hoarder, and also treatment for hoarders. As I've stated earlier, I feel that I'm qualified to talk to you on hoarding because I've done a great amount of research on hoarding, and also I've known people who are hoarders. I have shared with you the difference between a hoarder and a collector. And I would like to end by sharing with you some pictures of a hoarder's collection. And I thank you very much for listening.